Hello. Today I'm going to talk about occasional symptoms of depression. People who have more severe symptoms of depression may need further evaluation and seeing a specialist. This talk is really for patients who have occasional feeling of depression, especially if symptoms get worse as the weather gets colder during the winter, which is seasonal affective disorder. And I do see many patients in my practice who notice their moods get a little bit off and they feel a little bit more sad, don't want to go do things in the winter. And that's what really I would like to discuss to help those patients along and also increase awareness that there may be something else going on or supplements to take. If a person feels more depressed and severe depression or strong family history or strong prior history of depression, that may be necessary for those patients to see a doctor, because these recommendations may not be enough. But for many people who just have occasional symptoms and just want to do something to make them feel better, this talk may be very helpful and appropriate. If a person has symptoms of depression that last for more than a week, 2 weeks, there are a couple of things you can do. Most likely it is related to just the fact that there is not much sun outside, but there are maybe underlying causes of depression or feeling blue. Thyroid, adrenal conditions can present with signs of depression. Vitamin B12 or D deficiency can also present as mood swings, feeling depressed. Iron deficiency can present as with fatigue and signs of depression. For the past couple of years, I've seen several patients who had Lyme disease, and the only presentation were presentation related to the nervous system. So when there is an unexplained feeling of sadness or even anxiety, it is important to do the Lyme test just to make sure that's not an atypical presentation of Lyme. Other things I check is make sure there is no underlying infection, and cortisol level is great to check to see whether there is a decreased level which adrenals, when are not working well, can present as symptoms of depression. Many people just feel depressed. Some patients may feel anxiety alternating with depression, and that's also important to take into consideration. If the blood tests are done and there are some deficiency found, it is important to address that. Otherwise, it's important, there are two questions we usually ask in primary care to see whether a person has a clinical depression, is the sleep and interest to sexual activity. If a person answers no changes, then it's probably not a significant clinical depression, but just affecting seasonal affective disorder or moods related to the colder weather or stressful situations or other. The first herb that I recommend for people with depression is St. John's wort. St. John's wort has multiple beneficial properties. It's a great anti-inflammatory, but it's also a great mood stabilizer. You can take it in capsules, you can take it in powder, you can mix it with your applesauce, yogurt, whichever you enjoy eating. You can also make tea from it. That would be the most helpful for symptoms, depression, and just real lack of enjoyment. If a person also has fatigue, frequent fatigue, difficulty to get up in the morning, or feeling tired during the day, there are a couple of adaptogens that a person can take to balance their adrenals, and just giving yourself more energy will make you feel better in other ways as well. And I frequently recommend ashwagandha or ginseng. Those two supplements, they're great for adrenals. They'll give you more energy and frequently stabilize the moods in a good way. Also, occasional fatigue and feeling out of sorts, I like recommending cordyceps. Cordyceps are medicinal mushrooms, and they're good at strengthening the immune system and for energy. Especially if a person just went through a significant infection. We see many people with flu these days, or pneumonia, or any kind of significant infections and there is persistent fatigue and feeling sad afterwards, cordyceps and ashwagandha are really great supplements to take to get you back to your regular state of health. If a person has depression, and they can start taking the supplement, but some people may feel generally depressed, but occasionally experience flare up of anxiety or irritability. Then there are tinctures that a person can take on top of the antidepressant herbs just to get a fast relief with anxiety symptoms and feeling irritable and feeling out of control. I particularly like two herbs, which is lemon balm and passion flower. Those are mixed with water, quickly within a few minutes give you a feeling of calm and just make you feel better. Those are generally supplements which are very well tolerated, and most people can take them. There are a couple of homeopathic medications which are great for depression, but with homeopathy it's more important to find out the cause of depression, to see whether the person has additional symptoms, how people react in different stressful situations. So homeopathy may not, the same homeopathic medication may not work for everybody, and that usually requires a more personal and personalized approach in choosing a good homeopathic medication for symptoms of depression. And homeopathy generally works on a deeper level and addresses the other symptoms which can a person experience along with the depression. Another group of patients, I see quite a few women in their 40s, sometimes late 30s, early 50s, and depression can be a sign of a hormonal disbalance. And really in this talk I also want to raise an awareness that sometimes a new onset of depression, brain fog, unexplained fatigue can be a sign of hormonal disbalance. And the blood test may be normal, but it is important to address those symptoms. If the supplements don't work, blood work doesn't show anything, the symptoms persist, it is important to look into a possibility of hormonal disbalance. And that can precede actual hot flashes and irregular periods by a few months and up to a year, or even a couple of years. If you have any questions, I would be happy to answer them. You can ask questions in the comments. You can put them on my website. Depression is a very difficult condition to treat, and it should be addressed stepwise. And frequently, if a person doesn't have severe symptoms, the supplements taken either occasionally or on a day-to-day basis during cold weather and when we don't have enough light, they may help you a lot by improving symptoms, giving you more energy, and just generally improving your lifestyle. Thank you very much for listening, and I will see you next Thursday.